A expectativa de vida nos Estados Unidos caiu pela segunda vez consecutiva e é a maior queda em 100 anos. Em 2019, alguém nascido em território estadunidense tinha uma expectativa de vida de 79 anos. Em 2020, essa expectativa caiu para 77 anos. E em 2021, despencou novamente, para pouco mais de 76 anos. Os dados foram divulgados recentemente pelo Centro de Controle e Prevenção de Doenças, órgão oficial de saúde do país.
Life expectancy is a metric that's often misunderstood, and many times when we look at changes in life expectancy, the numbers don't look that big to a layperson. So if we say that life expectancy decreased by 1 year, that doesn't sound like a big number to many people. But it's important to understand what life expectancy actually refers to. Many people think it means how long a baby born in this year is going to live. And that's not what it means. We can't predict how long a baby will live because we don't know what health conditions are going to be like over the course of that child's lifetime or where they will be living. Instead, life expectancy for a given year is telling us something about the death rates during that year. These large decreases in life expectancy represent a massive loss of life. So I find it disrespectful to all of those Americans who died to say that it's not significant.
Muita gente acha que essa redução na expectativa de vida é um reflexo direto da pandemia, sobretudo porque os Estados Unidos foram um país com maior número de mortes em decorrência do novo coronavírus. Os estudos, porém, mostram que o problema é sistemático e antecede a pandemia.
The United States, for 2 decades now, has had the lowest life expectancy of any high-income country, and the gap has actually been widening over time. After 2010, life expectancy stopped increasing in the United States and began decreasing. And during that time, it was continuing to climb in other countries. And among the reasons for that decline in life expectancy was the problem with drug overdoses, but also other causes of death, alcohol-related disease, suicides, diabetes, obesity-related conditions. Many causes of death actually we saw increasing, and this suggested that there is a systemic reason for why Americans are doing so poorly. And all that was true before the pandemic started. So all of those systemic issues contributed to a very bad outcome in the United States during the COVID-19 pandemic, and it was compounded by some very problematic policy decisions made by the federal government during the pandemic.
A falta de um sistema de saúde público nos Estados Unidos colabora para a queda da expectativa de vida no país. Mas os especialistas afirmam que esse problema é menos relevante do que se imagina. De forma geral, os pesquisadores explicam que a saúde de uma população é mensurada a partir de 4 pontos: comportamento, ambiente, realidade socioeconômica e políticas públicas, sendo essa última a mais importante.
Policy decisions made at the national level, the state and local level are affecting access to healthcare, they're affecting health behaviors, they are affecting socioeconomic conditions, and they affect our environment.
Além de derrubar a expectativa de vida, essa realidade afeta também as expectativas por dias melhores.
If you're asking me whether I'm optimistic that that problem is going to get solved, I'm not. And the reason is, first of all, problems don't get solved until people recognize they have them. So I don't think the general public is aware that the health of Americans is so bad. And the sense of American exceptionalism, where Americans think they're number one at everything, gets in the way of them understanding the realities of the situation. And in this case, we're number one at dying, which is not a good thing.